Okay, welcome back. A little bit of housekeeping before I begin this webinar. It is a long one, a little bit on the detailed side. It's hard not to do that with the topic today. So if you're new to these kinds of webinars, my name is Dr. David Kunashko. I'm the medical director at BioFlex Laser Therapy. We are a medical device company that specializes in photobiomodulation, sometimes referred to as red light therapy or cold laser therapy. And we were or are the original manufacturers of this type of equipment going back to almost 40 years now. Now, these webinars, I do two types of webinars typically in a given month. One is a little on the technical side, more for healthcare professionals, although anyone can listen in. And then one more for people at home, perhaps using our home devices as well. These webinars are always recorded, and then they're edited, and then they're uploaded onto our educational site, which you can find on bioflexlaser.com. I always have time for questions at the end of these webinars. Typically, they go for about half an hour to 40 minutes. And then if there's any questions, I can answer them at the very end. Now, I'm going to really try my hardest not to say too many ums and ahs today. So if someone's out there and wants to count, let's see how many ums I get for today's webinar. I'm hoping to keep it under 5. That's my goal today, because sometimes when I listen back to these webinars, I'm going, oh my gosh, I say a lot. So I'm going to do my best, don't count that one, by the way, to limit those during the course of today's webinar. Okay, let's get started. And as I mentioned, the topic today is the immunomodulating effects of laser therapy. It's really quite a fascinating topic, one that's still being highly researched. So we don't know a ton, but we do know a lot. So I'm going to try to share that information with you today. So essentially, I'm going to talk about immunomodulation, what it is, and there's really two ways of doing immunomodulation. One are therapeutics. I'm going to go over that just so we can all kind of be aware of that. I think we've probably heard a lot about this, especially new drugs and different therapies coming out. It's a fascinating topic as well, too. And then there's natural immunomodulation, things you can do naturally. And really, photobiomodulation is one of those natural methods. So I'm going to talk a bit about what's out there as well. And then, of course, get into photobiomodulation and what it can do in our bodies with respect to modulating the immune system. And then I'll talk a little bit about our equipment, more so the professional equipment, and a little bit about how you might use that for immunomodulation, although a lot of that's really built in to how you're using it. So there's that as well. And of course, we'll have time for Q&A at the end. Ask me any questions you want during the course of the webinar. Just type them into the chat box. I continue to have problems with my Q&A box or my question box. I have no idea why. I've tried to reach out, but it seems that it's for some reason disabled during my webinar. I know it's probably in my settings somewhere, but I can't figure that out. So immunomodulation is the process of altering the immune system or immune responses to achieve a desired outcome. And of course, this is really important in helping manage various health conditions. A lot of the information I've taken for today's webinar comes from this article you can see below here, published this month, this year. So it's a very recent and up-to-date research article. So immunomodulation can occur naturally or through therapeutic interventions, as I mentioned earlier. And of course, they're going to target different components of the immune system. Let's talk first about some immunosuppressive therapies. Many of these you're obviously aware of, like corticosteroids, like prednisone. They typically suppress inflammation by inhibiting natural factor kappa beta, a key regulatory cytokine that's produced in the cells. So oftentimes these are used for like acute flare-ups of everything from rheumatoid arthritis and asthma and so forth. The problem is that they have side effects, and long-term use can lead to bone loss, like osteoporosis. It can even result in diabetes and weight gain, mainly through water. So these aren't the best, but sometimes these are the only option to use. Then there's biologics. This is a whole new kind of deal with drugs. And some examples you can see here, I don't know how to pronounce all these, but they tend to block tumor necrosis factor, which is a major inflammatory cytokine. And they're oftentimes used for RA, Crohn's disease, even psoriasis. These are all autoimmune issues, obviously. Unfortunately, there are some side effects, and this may be related to increased risk of infection, for example. Then there are immunostimulatory therapies. For example, checkpoint inhibitors. You can see the names of some of these drugs here. They tend to block what's called PD-1 or PD-L1 breaks on T cells, allowing them to attack tumors such as melanoma, lung cancer, Hodgkin's lymphoma. So these are used specifically for certain types of carcinomas or cancers. There are some side effects associated with them, including autoimmune reactions like a flare-up of colitis or attack on the lungs. You've probably heard of interferons before. These boost antiviral and anti-tumor immunity, oftentimes used in hepatitis and multiple sclerosis. And again, there are some side effects with those types of medications. Then there are some really interesting emerging and precision immunomodulation, like JAK inhibitors. These are quite complex, but this is definitely the way things are going right now. They're quite effective with not as severe side effects. They're oftentimes used in RA. They can even be used in alopecia and severe inflammatory aspects of COVID-19 as well. Then there are some interleukin inhibitors. You can see one here. They target specific inflammatory pathways and oftentimes used for different conditions like psoriasis or ankylosing spondylitis. Then we get into microbiome, which is really fascinating. So these are the gut bacteria. You can see an example here. I'm not going to try and pronounce that. My Latin is not particularly great. These can regulate immune balance, and potential uses include irritable bowel disease, certain allergies, immunotherapy enhancement. In fact, treating the gut is one of the ways I'm going to recommend that you can use photobiomodulation for immunomodulation. We oftentimes recommend to do that in conjunction with treating things like neurodegenerative diseases because of the gut-brain axis as well. And we've lectured about that a little bit in the past. So there are natural immunomodulators as well. These tend to be compounds derived from plants or microbes or fungi or animal products, and they may enhance or suppress or regulate immune responses, typically without the harsh side effects of synthetic drugs. The problem, of course, is understanding dosaging and how pure the compounds are, those kinds of things. So you do need to be really careful with that. Oftentimes they're used in traditional medicine, and then, of course, they're studied and then oftentimes made into a drug as well. Some categories include plant-derived immunomodulators called phytochemicals, for example, and again, we've heard about things like curcumin or turmeric. And the thing about when you do any of these things is you need to understand, is it right for you? So just don't start buying crap off Amazon and taking it. You really should see a healthcare professional to understand, like, are you okay to take turmeric as a supplement? Do you have any contraindications for taking it? So there are some issues sometimes that you shouldn't be taking some of these natural types of immunomodulators. Echinacea, of course, we've all heard about echinacea, and it seems to stimulate macrophage and natural killer cell activity. It can increase cytokine production, oftentimes used for cold flu prevention or just supporting your immune system. Some studies show reduced respiratory infections. Again, not tons of great research on it, but they really do feel that it has some health benefits. Of course, ginseng, you've probably heard about as well, Panax ginseng. The mechanisms here, oh, funny enough, when I was a student at university going back, I won't tell you how long, okay, over 40 years. So when I was taking my undergrad in molecular genetics, the lab I was in, one of the professors there was really into ginseng, and he was looking at all the different properties of using it for different antimicrobial effects and helping the immune system. So it's been researched for a long, long time. It can be used to support the immune system. It definitely seemingly has antiviral effects as well too. So it may improve vaccine responses and help reduce inflammation. I actually take ginseng every day, to be honest. I take it most days just in a tablet form. Resveratrol, these are often found in grapes and berries. You have to eat a lot of grapes and berries to get really good benefit from it, but they're there. Or, of course, you can take it as a supplement, provided that you know that it's pure and exactly how it's made and so forth. They may suppress pro-inflammatory cytokines, so helps with generalized systemic inflammation, oftentimes used for cardiovascular health or neuroprotection. Then there's mushrooms, which is a whole category. And, I'm not going to get into all of these different things to any great detail, but you've probably heard of some of these, reishi, or I'm not sure how you say that one. They're highly being studied, including activation of macrophages, dendritic cells, natural killer cells, oftentimes used in cancer adjunct therapy or chronic fatigue. Shiitake mushrooms, they're delicious, by the way. They can also help to support your immune system. Turkey tail, if you've ever been out for a walk in the woods, you've oftentimes will see turkey tail around, used for cancer immunotherapy. It's been approved in Japan, actually, which is quite interesting. Then there's the microbiome-defined immunomodulators, both pro and postbiotics. These, of course, as I mentioned, gut bacteria play a huge role in immune regulation. So probiotics, we know like lactobacillus and so forth, they can increase regulatory T cells or Tregs and reduce inflammation and can enhance IgA production or gut immunity. I see you might have some questions. I'll definitely get to those as we go along. So please keep asking away. And they can be used in things like irritable bowel disease, allergies, eczema, and so forth. Postbiotics, butyrate, short-chain fatty acids, they think that this suppresses NF-kappa beta anti-inflammatory effects. That's what, if you suppress NF-kappa beta, then you reduce inflammation. So it may be helpful for colitis or metabolic syndromes. Then there are animal-defined immunomodulators, colostrum from bovine source, B. propolis, and it contains flavonoids with antimicrobial and anti-inflammatory effects, oftentimes used for wound healing and antiviral support. How's my count for saying ums? I don't think I said one other than that one there. So anyway, the mechanism of action for natural immunomodulators, they can work through enhancing innate immunity, balancing T helper cells, reducing pro-inflammatory cytokines, and supporting the gut immune axis. One of the keys to a lot of this is your diet, just your natural diet and what you eat. You will get a lot of this through that. You don't necessarily have to take supplements for it if you have a better diet with respect to some of these things, although sometimes it's hard to get a lot of them on a daily basis. That's where you can supplement. And I think there are some benefits overall. Clinical applications include autoimmune diseases like RA or lupus or irritable bowel disease, perhaps supporting cancer, chronic infections, allergies, and asthma, and so forth. Some of the challenges with the natural immunomodulators is, of course, standardization and potency, potentially drug interactions, and that's where it's really important to understand. Just don't start taking these things willy-nilly. Understand that if you're on medications, is it right for you? Are there interactions? There can certainly be interactions, right? B, not P. So be careful of that and speak to healthcare professionals. And oftentimes there's really limited large-scale trials just because there's not a lot of money in it for the research and whoever's doing this. So that's why you tend not to see that. It's not like Big Pharma is against it. It's just that Big Pharma doesn't care unless they try to make a drug out of it, if you know what I mean. So in general, natural immunomodulators offer a gentler, holistic approach to immune balance, but obviously should be used wisely, as I've just mentioned. So let's talk a bit about photobiomodulation or laser therapy. The fundamental mechanisms of PBM, basically how it induces immunomodulation at the cellular level, is primarily through interactions with mitochondria. So when cells are exposed to certain wavelengths of light and certain intensities, certain photoreceptors, especially within the electron transport chain that produces ATP, are affected, including cytochrome C oxidase. This leads to a cascade of events. It's not just one event, it's a whole series of things that happen because of that initial interaction, and this will lead to improved cellular functioning and signaling. This essentially encompasses what I've just said. So when the light, which is represented by these red squiggly lines, is absorbed through and into cells at the level of the mitochondria, specifically this orange blob here, cytochrome C oxidase, that will trigger ATP production, an increase in ATP production, a release of nitric oxide, a small spike of ROS, which is a free radical, which then triggers the cellular effects with respect to protein synthesis And these proteins that are made help protect the cell from further damage and help enhance the healing. There's been work done in vitro and ex vivo, and you can see different pathways. These get kind of complex, but these are the pathways on the immune system and how it can activate different pathways, the innate immune system and inflammatory response. It can either increase or decrease interleukins, and they can be absorbed directly in immune cells to have a very profound effect. This is where we're seeing benefits of photobiomodulation and immunomodulation. So photobiomodulation has been shown to enhance phagocytic activity, which is the ability of cells like macrophages and neutrophils to essentially surround and engulf and destroy pathogens. Think of your body trying to protect against a bacteria or something foreign in your body. It can also have an effect on cytokine production. These are molecules that help regulate immune responses, and lymphocyte proliferation, which involves the expansion of immune cells like T cells and B cells, and these are critical for what's called adaptive immunity. So photobiomodulation can also basically modulate reactive oxygen species, which are ROS, or these are free radicals, as well as nitric oxide release, as I just mentioned. And they play an important role in the immune regulation and inflammation. Research has shown that photobiomodulation can increase ATP production by up to 70% in certain cell types, providing the energy necessary for enhanced cellular activities, as I just mentioned. This energetic boost is crucial for immune cells, which often require rapid and energy-intensive responses to stimuli. Now, I'm going to give you this kind of insight. When I first started at BioFlex, and now it's been 14 years since I've been here, I'm a chiropractor, and so I didn't treat wounds, right? I didn't treat infected wounds. It's not in my scope of practice. But Fred Kahn, who was the medical doctor who founded BioFlex, he was a vascular surgeon. And in our clinic, we had a wound healing facility, right? So I got to go in there and help out and everything. I wasn't treating it as a chiro, I was just an assistant. And what we really observed, and what I was really noticing, along with the wounds that were healing faster, was that these wounds were often infected. And you could see photobiomodulation was helping the infection. Now, I can't say here's a protocol for reducing infection, and we're not cleared for infection. We know that. But this is why it's helping with the infections, is the effect around the immune system locally that's fighting that infection by boosting the energy of the immune cells like macrophages and neutrophils that are trying to fight the bacteria. And that's where you see the benefits in treating these infections. It's not like you're using it to treat the infection. We're treating the wound, but alongside the benefits were antibacterial aspects or the immune modulating effects. Really fascinating to see and observe this in real action. So with respect to modulation of ROS, photobiomodulation, as I think many of you are aware, has a biphasic effect on ROS production. For example, low dose photobiomodulation, 5 to 10 joules per centimeter squared, I'm going to talk about this towards the end of the lecture, has been shown to reduce excessive ROS levels in oxidative stress conditions, thereby protecting cells from damage and promoting cellular repair. So when you go to treat an injury or condition that's inflamed, you want to use low-dose photobiomodulation. That's why I always have a connection when I hear people say about class 4 laser therapy and how wonderful it is. The problem with class 4 laser therapy is the energy density, which is what I'm showing you here, is significantly higher than 5 to 10 joules per centimeter squared. It's like crazy high. So it's not doing low-dose photobiomodulation. What that is doing is blocking analgesic aspects of nerve conduction for pain fibers, which is fine for blocking pain. And it might have an effect on healthy cells, and I'll get to that in a second. But what it's not doing is low-dose photobiomodulation, helping with protecting cells from damage and promoting cellular repair. I'm sorry, class 4 laser therapy people, read the research and understand that nearly all research that's done in this field uses low-dose, low-energy density photobiomodulation. Okay, I'll try not to have a heart attack as I'm doing this. All right, so conversely, higher doses of photobiomodulation, 20 to 50 joules per centimeter squared, can temporarily increase RS production in healthy cells, which acts as a signaling mechanism to stimulate cellular proliferation, antioxidant defenses, and immune activation. So if you want to boost the immune system, higher doses are probably going to make sense here. At lower doses, photobiomodulation tends to reduce excessive ROS levels in stressed or inflamed tissues, exerting an antioxidant effect. And at higher doses, in normal cellular conditions, PBM induces a mild transient increase in ROS. Now, ROS is bad if it's too high for too long, but in short spikes, it basically slaps the cell around a little bit and wakes it up to be more active. And so it can do that in healthy immune cells by taking it to an altered state and saying, whoa, 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 I'm going to start doing something here. And that's the effect on the immune system, you know, in a generalized way of saying it. So this modulation of ROS levels plays a significant role in immune cell signaling and function. Low levels of ROS can act as signaling molecules, activating redox-sensitive transcription factors like NF-kappa beta, AP1, which are crucial in immune cell activation and cytokine production. So the ability of photobiomodulation to essentially fine-tune ROS levels allows for precise modulation of immune cell behavior. This is where we're still trying to figure out exactly how to use PBM for this in humans. This little diagram to show you kind of what I've just talked about. Yellow is photobiomodulation and how it can have an effect on macrophages, on T cells, and dendritic cells. Macrophages play a crucial role in both innate and adaptive immunity, and their modulation by photobiomodulation has significant implications. So at wavelengths between 600 and 1,000, and again, there's some better wavelengths in there, typically around 630 to 660 and maybe 780 to 840, 850. These promote macrophage polarization towards what's called the M2 phenotype. So macrophages can be M1 or M2. Basically, they change their state. And photobiomodulation modulates the cytokine production profile of macrophages, generally favoring the M2 phenotype, which is the anti-inflammatory state. So when macrophages go from M1 to M2, they're now anti-inflammatory and help to reduce inflammation in that area. Studies have reported decreased production of pro-inflammatory cytokines, as I've mentioned here, while increasing the secretion of anti-inflammatory mediators. So it reduces pro-inflammatory, increases anti-inflammatory interleukins and cytokines. T lymphocytes are central to adaptive immunity, and their modulation by photobiomodulation seem to have far-reaching effects on immune responses. So it's been observed that photobiomodulation can influence the balance between different T cell subsites. I'm not an immune expert here by any stretch of the imagination. It's been a while since I took histology, but essentially research shows that PBM can promote differentiation of what's called naive T cells into Tregs or T regulatory cells. And these are crucial for maintaining immune tolerance and preventing autoimmune responses. That's why we see benefits in conditions, especially like rheumatoid arthritis and some other autoimmune systems. In fact, we have an autoimmune protocol. I'm not sure if you're aware of that or not, but we do have one that we found effective for these kinds of scenarios. Several studies have reported an increase in the number and function of T regulatory cells following photobiomodulation, and these are particularly relevant in the context of autoimmune diseases because it can help suppress excessive immune responses. Dendritic cells, or sometimes called DCs, are professional antigen-presenting cells that bridge innate and adaptive immunity. So basically, they present the antigen to the immune system saying, hey, guys, do something here. We're being attacked by whatever, virus or bacteria or what have you. So photobiomodulation has been shown to influence dendritic cell migration, maturation, and these are crucial for their function in initiating these T cell responses. Some studies have reported enhanced dendritic cell migration to lymph nodes following photobiomodulation, potentially improving the efficiency of antigen presentation. So it's really fascinating how this might work. All of this, by the way, is from this main article I referenced at the beginning of the lecture. So I'm not making this stuff up, just in case you're wondering. Any reports on how many ums so far? Just let me know. All right, so recent studies have shown that photobiomodulation can alter the phenotype of dendritic cells, influencing their functional characteristics. Essentially, this includes changes in surface marker expression and cytokine production profiles, which can significantly impact their interactions with other immune cells and essentially shape their role in the immune response. Now, let's talk about clinical applications here. What they've done is they've summarized all the potential, at least research that's on certain conditions and where photobiomodulation might be helpful for some immune-related conditions like rheumatoid arthritis, systemic lupus erythematosus, multiple sclerosis, allergic rhinitis, inflammatory bowel disease, psoriasis, COVID-19 related inflammation conditions. And you can see here the wavelength range, anywhere from red and near infrared, makes sense. Power density. Notice that these aren't class 4 power densities. So I'll stop on the class 4, but it just irks me. And then talking about the primary mechanism involved and the clinical outcomes and the level of evidence. Some are limited, some are moderate, which is good. So it ranges, but there's everything from moderate to limited to emerging levels of evidence. So we're seeing the trends anyhow. Of course, it can also be used, photobiomodulation can be used for wound healing and tissue repair. It's been shown to optimize inflammatory phase of wound healing. We see that a lot in treating wounds. We're just finishing up a large clinical trial of 160 women that have had a cesarean section, and we're monitoring their wound healing as well as pain. That's at McMaster University, and there's 2 hospitals in Hamilton, Ontario, Canada, that we're running this trial using BioFlex equipment. Photobiomodulation can also enhance tissue regeneration. That's really important. As a chiropractor, a patient comes in and they've injured a tendon or a muscle or a ligament or whatever it is. I can only do so much with my hands, okay? So end of the day, the body has to heal it. That's why adding photobiomodulation to a clinical practice really adds to what you're doing with respect to your hands. I know sometimes some chiropractors tend to say, look, I can do everything I need to do with my hands. Sorry, it's not true. It's just not. What are you going to do for Achilles tendon, right? Or a torn ligament? Doesn't work that way. You can help the body with adjustments and everything and help overall how that body's responding. But if you want to accelerate directly in the tissue that's injured or diseased, photobiomodulation works like no other type of therapy that is out there. This is also from this particular research article, and what they've highlighted here in the green dots is the optimal treatment parameters, including wavelength range, power density, and treatment duration. As an approximation, you can see roughly it's in the, so 600 is just at the beginning of red. So it's starting to get into the red zone here, and then the near infrared. So essentially this is around 660, 640, and around 850. That's where this block shows here. Power density as low as maybe 10 milliwatts per centimeter squared. By the way, our power density for our dual arrays is 10 for the red, 20 for the near infrared at 100% power. So 10 milliwatts per centimeter squared, 20 milliwatts per centimeter squared. That's for the array. Okay, so we do fall into just using the array, and that's also for home systems as well. We would be roughly here. Our laser probe is much higher. It's way higher. In fact, it's in the zone as well. Treatment duration. Notice the treatment duration isn't 2 seconds or 10 seconds. It tends to be in the minutes. And that's really important because you need longer treatment times to be effective for this type of treatment, in general for photobiomodulation. So if you are told, hey, just use something and just treat it for a few seconds, that will be fine, That's not the case. Now, when we use the laser probe, yeah, we're treating an area for 10, 15 seconds, but the energy density is extremely high. And what we're trying to do there is very different than a slow burn for immunomodulating effect, like what I'm representing here. So as far as dosage and wavelength considerations, the efficacy of photobiomodulation on the immune system is really dependent on the parameters, as I've just mentioned. There's an optical window, 650-ish red, up to 950 near infrared. And as I mentioned, there's different dosaging energy densities from 1 to 10 joules per centimeter squared. It's important to note that these parameters can vary depending on the specific condition being treated and the target depth. So you may need to go much higher or lower depending on what you're trying to do, where the target is, right? So you can't just use one dosage for everything. It just does not work that way. Potential side effects and contraindications are few. This is considered an extremely safe type of therapy. There have been reported transient side effects like fatigue. I see fatigue a lot, mild headaches. Sometimes that happens, but these are in a small percentage of patients and they go away. They're self-limiting. They don't cause any issues moving forward. Contraindications, really the key ones are don't treat over cancer, don't treat over your thyroid gland. Those are the two main ones. Don't put a laser in your eye, kind of common sense things. Thyroid gland is really sensitive to light, so energy-based therapies, including light therapy, may have an effect on the thyroid gland. So we need to kind of steer away from that. And with respect, oh, sorry, back up a bit. You just need to, oh, sorry, I'm back up here. With respect to cancer, like we just don't know the effects on cancer tissue in vivo. So again, it's considered a contraindication to treat over an area directly that has a carcinoma. So it's important to have caution when you're using photobiomodulation. Make sure you're not doing something that's contraindicated before you start treating. Now, as far as our equipment goes, well, this is the main piece of equipment that we have, which is this Dual Plus 240. It has red and near infrared. The red is 660 nanometers. The near infrared is around 840 nanometers. So it's exactly in the range that I've been talking about. You can see the total power, which is meaningless. What's important is the energy density or the power density. It ranges from 10 to 20 milliwatts. And of course, as you add time, you increase the energy density because that's joules per centimeter squared. I'll give you an example of that shortly. Well, this slide. So we talked about low dose PBM, 5 to 10 joules per centimeter squared. If we use the red portion of the array, 6 to 8 minutes, 100% power, that gives you roughly 3.6 to 4.8. So on that lower end of that low dose PBM, that's 6 to 8 minutes. You can adjust that however you want to. And for near infrared at 6 to 8 minutes, it's roughly 7.2 to 9.6 joules per centimeter squared. Again, it falls within that known low dose PBM. This is really important because, as a healthcare professional, and maybe you don't have our equipment, maybe you're just kind of learning a little bit about it. If you don't understand these concepts or understand what your equipment's putting out and you just try to start using it, oftentimes you don't get the results you're looking for because unfortunately you don't really know what they are. And you don't know if your equipment falls in those ranges to do that. So it's really important to understand what your equipment is outputting, the specs, right? Higher doses, like 20 to 50 joules per centimeter squared, these can temporarily increase ROS production in healthy cells, which act as a signaling mechanism to stimulate cellular proliferation, antioxidant defenses, and immune activation. This is probably better achieved for deeper structures using the laser probe. So for example, 20 seconds of the laser probe gives you roughly 36 joules per centimeter squared. And of course, that falls in that range. If you want to treat for longer, just lower the power. If I went 10% power on the probe, I could do it for 200 seconds and get that same energy density. Really, choice is up to you. I prefer longer treatment time and lower power. So the example I gave here is 100% power. I can knock it down to 10% power, but now instead of 20 seconds, I have to hold it in one spot for 200 seconds. That's a little unrealistic in a clinical setting. So you have to kind of balance that out as far as your approach goes. Those of you who are not aware and have our equipment, Dr. Khan did his own personal clinical manual with off-label protocols, including things for autoimmune, inflammatory conditions, psoriasis, gout, eczema, dermatitis, rheumatoid arthritis, wound healing. A lot of these fall in the immunomodulating aspects of photobiomodulation. If you have our equipment and you're interested in this guide, we can send it out to you. If you don't have our equipment, then you're going to have to buy our equipment. So now with respect to targets, well, back up a bit here. The sternum is a great target because it contains bone marrow, which is a source of stem cells like mesenchymal stem cells and hemopoietic stem cells. So this is a really good target for stimulating the immune system. I mentioned the gut, adipose tissue-derived stem cells and mesenchymal cells, which have the capacity for self-renewal and can also be differentiated into adipocytes or chondrocytes or myocytes or osteoblasts or neurocytes. They can change their cell lineage, and you can stimulate over the abdomen to perhaps help with this as well. And light can penetrate into adipose tissues pretty efficiently to target these cells. And of course, some of that light may reach the gut, although it's kind of limited because it lies pretty deep. Another target might be the popliteal region. This is because it's highly vascularized, and you can throw the array back there, and you can treat a lot of blood that's circulating in that area as well. So that's it for the lecture today. In the news, we just signed a contract with the TNA Wrestling, Professional Wrestling Association. This is one level down. I'm not a big wrestling fan, but these guys are athletes, and women. These are athletes. And so we're setting up a performance recovery and performance sort of mobile room for these athletes as they tour around. They're going to be in Brampton in May, by the way. So this is quite great for us because we get to use our equipment on some of these top tier professionals that can kind of spread the word out about BioFlex to all the fans of TNA. You may be one of them, I'm not sure. Next couple of webinars are here, and you can sign up for them for free on our website. Some questions here. I did have a comment that my voice is breaking up and there's an echo. I tried to attach my good microphone and I couldn't get it to work today, so I'm hoping that it wasn't the case for the entire lecture. Would it help compartment syndrome? Yeah, I mean, Michael, definitely it can help compartment syndrome. It can reduce swelling and reduce inflammation in that compartment syndrome. Those are challenging conditions for sure, but I think it would be very helpful. I don't see any other questions. So either that was good news or bad news. Let's just see if there's any other questions here. Okay, it sounds like the audio was pretty good through the lecture. Anyway, thank you very much for listening in today. I hope to see you at the next webinar. And I know we have some other events coming up. Just go to our website and you can see the different events we have. We'll be doing an advanced certification training course on concussion in the fall time in Toronto, and we'll also be doing one in Montreal. Also a masterclass in the fall time in November. So start looking for those, and we'll see you at the next events. Take care now. Oh, I see a question here. A patient with giant cell temporalis. Okay. Yeah, so that is an inflammatory condition, Mark. I think it would be helpful. Maybe email me on that one. I need to think about it, that one a little bit. All right, have a great day, everyone. Take care now.